This is Nasim Miller with IMNG Medical Media. I spoke with Dr. April Armstrong about her recent study of treatment trends among patients with psoriasis and psoriatic arthritis.
In this study, we looked at over 5,000 patients with psoriasis and psoriatic arthritis who completed a survey that was distributed by the National Psoriasis Foundation. And we found that during the 8 years between 2003 to 2011, for patients who were diagnosed with mild psoriasis, anywhere between 36% to about 50% of them were not treated at all. And then for patients with moderate psoriasis, between a quarter of them to about 35% of them are also not having any treatment for their moderate psoriasis. What's most alarming is that for patients with severe psoriasis, anywhere between 10% to 30% during that period did not get treatment. We also found that for those who are getting treatment, and for especially the moderate to severe psoriasis patients, a significant proportion were getting only topical agents alone when other modalities such as systemic agents and phototherapy might be warranted in some patients. Another major finding is that a lot of patients were unsatisfied with their treatments. That is, over half of the patients with psoriasis reported that they were not satisfied with their treatments, and a little bit under half of the patients, so 45% of the patients with psoriatic arthritis, reported that they were unsatisfied with the treatments for their arthritis.
What are the implications of your study?
The results of our study have several implications. Number one is that for the payers, hopefully they will pay attention to these findings and think about ways in which they can work with the providers to make it easier or more accessible, the various treatment options to our patients. Many of our patients with moderate to severe disease for psoriasis as well as psoriatic arthritis may need more systemic treatments, and then we've all been in situations where our recommended treatment have been denied due to insurance reasons. And we hope that the payers will pay attention to the results of this study and understand potential consequences of those decisions on our patient population. For dermatologists who are actively in practice and treating our psoriasis patients, for us to understand that over half of them are dissatisfied with their treatments is important, and actively solicit from the patients what the treatment goals are from them and see how that aligns with our treatment goals for us is important. So I think this dialogue together will be important to making sure that our patients become satisfied with the treatments. Also, staying abreast with all the various treatments for psoriasis and making them available to the patient and individualizing the treatment for the patient so that we can achieve the best outcome is also important. A final implication of the study is that for psoriasis patients, as you can see, many of them are not treated, and hopefully they will think about ways to seek treatments from dermatologists so that they are not suffering alone with the consequences of psoriasis and psoriatic arthritis. So I really hope that some patients will be able to seek active help from our colleagues in order to get their disease under better control.